Joining us now on the Oakland County MegaCast is Dr. Ronald Lederman. He's an orthopedic surgeon and sports medicine doctor over at the Center for Orthopedics and Sports Medicine. Thank you for being with us this morning.
Thank you for having me. What a beautiful morning.
We have had some amazing weather this summer and this fall. We deserve it with everything we are going through, right?
Totally agree. It's wonderful to see. Have you ever seen more people outside walking and jogging and biking and socializing at a distance with wearing proper masks? But it's just been beautiful. And of course, the cool weather is upon us. So people are figuring out different ways to stay active and healthy.
So with that, what injuries are you seeing in your office now that you're reopened?
Well, it's kind of interesting, during this time of year, football has the most injuries of any sport. And I could tell you the day football practice started almost every summer, usually in August, because we would see kids coming in, whether it be middle school, high school, even college, with the finger fractures, the ankle injuries, the knee injuries. And you can almost gauge that with the start of each sport, whether it be lacrosse or soccer or basketball, certainly. Although we haven't had the organized school sports, a lot of people have been doing the travel sports, travel soccer, travel lacrosse, and we're still seeing plenty of injuries. And people are just trying to be as active as they can. So we see some overuse injuries in people like me, the weekend warrior, the middle-aged, the getting up in years people that still want to stay active and fit, which is one reason at Lederman-Kwartowitz Sports Medicine Orthopedic Center, we love treating, whether it be the high school athlete or the 85-year-old that wants to continue to be able to walk their 2-3 miles a day. It's so important to be able to treat everybody as their own type of athlete. And we have some really unique ways of keeping people fit, keeping them safe, getting them healing their sports injuries faster.
Dr. Ronald Lederman with us, an orthopedic surgeon and sports medicine doctor at the Lederman-Kwartowitz Center for Orthopedics and Sports Medicine, joining us on the Oakland County MegaCast. Dr. Lederman, as high school athletes in contact sports like soccer, and then tomorrow high school football season begins with some games tonight and the remainder of them on Friday. Also, other athletes like in the high-profile situations such as those in professional football who have began their season as well. What are some things that you are advising to athletes at all levels that are returning to their organized contact sports with minimal preparation time, not a preseason or a longer off season like we normally see for high school and NFL football? What do you tell these athletes to help them prepare themselves for getting back into competition and prevent themselves from being in the spot where they could potentially get injured?
Well, it's a great question because the sports world, from the NBA to the NFL, all the way down to our kids' schooling and the organized sports at that level, has been turned on its head. And they haven't had the proper preparation, and they've shortened seasons because of it. But the best advice you can give someone is to prepare as best you can. A lot of warm up, a lot of stretching, obviously get as much conditioning in as you can. And we're going to see, especially in football, we're going to see some of these injuries that will sideline the high profile athletes. But we are seeing that. We're trying to get word out to the coaches and the athletic trainers. You almost have to take it on an individual basis. If a kid or an athlete is complaining of pain or discomfort, you have to listen to that. You might have to back off. You certainly need to consider modifying what they're doing. But it is a concern. It's a valid concern.
So how do we know when to shake it off or when to actually go see a doctor such as yourself?
If somebody tweaks their knee or their shoulder or their ankle, if they can get up and walk around and within a minute it feels pretty good, they're probably fine. But if it swells, if they take a certain move and it doesn't feel like the joint is stable or going to support them, that's worth giving a call and coming and getting evaluated. Very often we'll see an athlete a month after an injury. They didn't think much about it, and now the opportunity to really get them better quickly, that window has closed. When we see people with an acute injury, meaning it's happened same day, next day, and that's one great thing about Lederman-Kwartowitz Orthopedics is we hold spots available for an acute injury. And like I said earlier, it doesn't have to be a high school or college athlete. It can be your grandparent who was going down to the mailbox, twisted the knee, or they wake up one morning and the knee is swollen and painful. We have slots for urgent add-on, whether it be a sports injury or, like I said, someone older that just is feeling new pain with new swelling. But get in, get evaluated. We have a lot of alternative medicine treatments for athletes, and I do keep using the word athlete, even if it's your grandparent, because we treat everyone with the sense of urgency to get them better. And when you think about it, of course you want to get an athlete better quickly so they can participate in practices and the next game. But I've always contested that it's more important to get that 70, 80, 90-year-old person better quickly, because that has more of an impact on their overall quality of life.
I will say I've been watching Hard Knocks on, I think it's HBO or Showtime, and it's been such an education about how they do treat the injuries for these high-level athletes. But as you said, everyone is an athlete, even if you're going out for the first time. And we are seeing so many people hitting the trails, hitting the gyms after they've been locked down for so long. If they do have an injury, how do they know when to come to you versus an urgent care? Do you need a referral to come to your facility first?
Typically you don't, but if you've injured yourself and your internist or primary care doctor is required to generate a referral, very often you can just call them. Almost all of the referring physicians in the area certainly know about us. Lederman-Kwartowitz, we've been around for 20 plus years. I've been here in town for 26 years practicing orthopedics. But to answer your question, how do you know when to be seen? Several issues. If it's hurting a lot, that's telling you might have, done some damage. Damage could be a partial or a complete torn ligament. It could be swelling in the joint that might need to be more closely evaluated. Difficulty putting weight on your hip, knee, or ankle, that would be reason to be seen. Difficulty moving your hand, your fingers, your elbow, or shoulder, that's worth getting seen. And I believe it's better to be seen sooner than later. Some of the different things that we do are really unique. As a surgical group, as a surgical practice, we do everything we can to keep our patients out of the operating room. And once our patients know that, they're much less afraid or resistant to come in for evaluation. A lot of people are afraid if you go to an orthopedic surgeon to get treated, it means you're going to have surgery, and that's absolutely not the case. We have a class 4 cold laser in our on-site physical therapy, and we have a greater than 90% success rate in getting people better without surgery when we get them into our very skilled therapy department and laser. But now with regenerative medicine, we are getting people better and avoiding surgery with stem cell regenerative therapy, with PRP injections, and all of this can be done right there in the office with our ultrasound guidance. So many options. We try and make ourselves available to the entire community so they don't have to go to a hospital. Nobody really wants to go to a hospital now where there are some COVID patients. Urgent cares are great for after hours, but they often don't have the in-depth knowledge of the orthopedic injury. So if you can wait until 8 a.m. until 5 p.m., we typically can get people seen, and it's better to be seen sooner rather than keep putting it off.
Dr. Ronald Lederman, with this orthopedic surgeon, as you said, it can be a scary word. Can you give us a little bit more information, though, on the alternative medicines and why that works as well and keeping people out of the operating room?
Yes, and I can tell you that I've used it on myself, on my family members, because if I had my family member go to a general surgeon for whatever they were complaining of, I would certainly hope that that surgeon would look at every possible potential cure short of surgery. And that's just the way I practice, and that's the way Dr. Kwartowitz and Dr. O'Keefe and all the doctors at our office, Dr. Hyman, who specializes in neck and back. So we were really on the forefront of regenerative medicine. Stem cell therapy is typically, we have these vials of stem cell type tissues that are donated by the mother after a healthy newborn delivery. And the tissue comes from human umbilical cord, it comes from the amniotic tissue. And we have found that when we combine certain stem cell products and we use the proper indications, our patients are doing remarkably well. Some people that are coming to us that have been told by several other orthopedic surgeons they need joint replacements, they're getting rid of 90% of their pain, and they're enjoying a quality of life, and they're getting back out on a gorgeous day like today and taking their 2-3 mile walks. Before COVID, they were able to take their vacations and go hiking out west or up north. So the regenerative medicine has been huge. PRP is where you draw blood. You might draw blood from your arm. We spin it down in a fancy centrifuge that's in the office, and we're left with a few cc's of plasma-rich protein from your own blood. And the studies have shown that 2 or 3 of those injections into a damaged joint, an arthritic joint, into a damaged tendon can really help. I have a couple of remarkable cases where I had a college scholarship tennis player, and he's a big guy, plays tennis all the time, is fantastic, and he was having severe Achilles pain. Came to the office, a lot of swelling around the Achilles. We got an MRI that showed 50% partial tear of the tendon, 50%. Typically, we'd have to schedule him for surgery and clean out all the scar tissue and reconstruct that tendon. And that's a 12-month recovery. Instead, we injected his tendon with the stem cell product that we use. And 3 months later, the swelling was almost completely gone. His pain was completely gone. He was chomping at the bit to get back out there. I repeated his MRI, and I have side-by-side photos. The 3 month after stem cell injection, the MRI said that the Achilles appeared normal. The partial tear was gone. The scar tissue was gone. It was remarkable. And that's objective data. So we're seeing that every day with our patients and trying to get the word out because people are doing so well with that. And it doesn't involve surgery.
Amazing advancements being made in medicine. Dr. Ronald Lederman, orthopedic surgeon and sports medicine doctor, Center for Orthopedics and Sports Medicine. Thank you for being with us on the Oakland County MegaCast and sharing that information and that insight. Don't be afraid to go to the doctor, to the orthopedic surgeon. You all are doing incredible work over there. Thank you so much for being with us. We appreciate your time.